One of the things that the Foundation Futures program does is it brings people who are new to long-term care or even just have an interest in long-term care to help them understand really the details of what's happening and how to work through that process. And what it really does is it brings AMDA, the Society for Post-Acute and Long-Term Care, to young people who are interested in long-term care to show them the energy, the excitement, and the reason why we do this. I'm really excited about this year's Futures program. First of all, it's the first time we've been in person since 2019. And so we were able to really capture the energy of being in person. This year we had a lot of alumni who presented to our Futures. And I think that was very important for them to see how they can move through the organization and reach its ranks, because one of the previous co-directors of the Futures program is a former president now, Heidi White. And she came back and was talking to our participants this year. And I think really being able to see who was a future in the past, such as Suzanne Gillespie, and now she's our president. And so really seeing that and seeing where their place can be in the organization. This year's program, I think, was very impactful by seeing people coming back, the alumni. Alumni came back and presented to the group and were able to really see what the future can look like for an individual within the organization. Another thing is that I think it was a very energetic opportunity for networking. For the Futures actually sitting side by side at tables, having conversations, creating lifelong partners, friends, people that they'll have opportunity to have reunion with when they come back to future AMDA meetings. So the networking was really important. It's interesting. I went into geriatrics knowing that I wanted to work in nursing homes. And the reason is because I love the social history. I love knowing the details about people and how they grew up and really how that impacts their lives today. We really, in post-acute and long-term care, are a healthcare part of the healthcare system that, first of all, not well understood, but it's so rewarding when you can see how you bring families together around a patient and their medical problems and their psychological issues, when you can send someone home after they've been in your facility for a while getting therapy. So there's so many things that make you feel good about being a part of their lives at that time. One of the things I always say is, I'm glad we were here when you needed us. Get ready for the ride. So PALTC is not only a group of people who have historically taken care of very frail individuals. So one, be ready to take care of the frail. The second part is be ready to advocate for the people that we take care of. So when people walk into PALTC and into individual nursing facilities, it's really taking care of them in a very good clinical manner, but also really elevating the nursing facility in the eyes of the staff, in the eyes of the community, and in the eyes of our patients and families. We still have those people saying, I'm never gonna put mom in a home, but when they recognize what it is that we can do for them, I think that's really what makes us keep doing this. Absolutely. Regarding the Futures program, because it is, again, so important to the future of PALTC, I really just want to make a plea for donations and for support. We have state chapters who have supported their fellows in coming to the Futures program. And we need individuals who also recognize how important this work is for the longevity of the organization. So please give.